ഹായ് എല്ലാ പ്രിയപ്പെട്ടവരും നമ്മുടെ അടുത്ത വീട്ടിലേക്ക് സ്വാഗതം. അപ്പോൾ ഞാനിന്ന് വന്നിരിക്കുന്നത് റേച്ചൽ ആംസ്ട്രോങ്, അതായത് ഞങ്ങളുടെ ഇൻ്റർനാഷണൽ നഴ്സസ് ടീമിൻ്റെ ലീഡായിട്ടുള്ള നഴ്സ് റേച്ചൽ ആംസ്ട്രോങ്ങിൻ്റെ വീഡിയോ ആയിട്ടാണ്. അപ്പം ഇവിടെ ഇൻ്റർനാഷണൽ നഴ്സസിനെ റിക്രൂട്ട് ചെയ്തിരുന്ന ആദ്യ സമയം മുതൽ ഈ പ്രോഗ്രാം ലീഡ് ചെയ്യുന്ന റേച്ചലാണ്. ഈ ജോലിയിലിരിക്കാൻ ഏറ്റവും സ്യൂട്ടബിൾ ആയിട്ടുള്ള ഒരു വ്യക്തിയാണ് റേച്ചൽ. അതായത് നമ്മളെ വളരെയധികം സപ്പോർട്ട് ചെയ്യും, നമ്മളെ എൻകറേജ് ചെയ്യും, മോട്ടിവേറ്റ് ചെയ്യാനും ഒക്കെ ആയിട്ട് ഭയങ്കരമായിട്ട് അത്രയ്ക്ക് മുന്നിൽ നിൽക്കുന്ന ഒരു വ്യക്തിയാണ് റേച്ചൽ. അപ്പം ഇപ്പം എൻ്റെ മാനേജറായിട്ട് റേച്ചലാണുള്ളത്. ആ ടീമിൽ, റേച്ചലിൻ്റെ ടീമിലാണ് ഞാനിപ്പോൾ വർക്ക് ചെയ്യുന്നത്. നിങ്ങളോട് ഞാൻ പറഞ്ഞിട്ടുണ്ടല്ലോ. അപ്പം ഞാൻ എന്താ പറയുന്നത്, റേച്ചലിൻ്റെ കീഴിൽ ഈ ടീമിൽ ഞാൻ വളരെ ഹാപ്പി ആയിട്ട് മുമ്പോട്ട് പോകുന്നു. അപ്പം റേച്ചൽ വന്നിരിക്കുന്നത് എന്താണെന്ന് ചോദിച്ചാൽ, ഇൻ്റർനാഷണൽ നഴ്സസിൻ്റെ റിക്രൂട്ട്മെൻറ്റിനെ കുറിച്ച്, അതെങ്ങനെയാണ് നടത്തുന്നത്, അല്ലെങ്കിൽ അത് കഴിഞ്ഞിട്ട് നിങ്ങളോട് വന്നു കഴിയുമ്പോൾ ഉള്ള നിങ്ങൾക്ക് തരുന്ന സപ്പോർട്ട് ഏത് വിധത്തിലാണ്, നിങ്ങളുടെ OSCE കുറിച്ചുള്ള ചെറിയ കുറച്ച് ഇൻഫർമേഷൻ, OSCEക്ക് നിങ്ങളെ സപ്പോർട്ട് ചെയ്യുന്നത് എങ്ങനെയാണ്, പിന്നെ വാർഡിൽ നിങ്ങളെ സപ്പോർട്ട് ചെയ്യുന്നത് എങ്ങനെയാണ്, ചെറുതായിട്ട് ബ്രീഫായിട്ട് അവിടെ ഇവിടെയൊക്കെ ആയിട്ട് കുറച്ച് കാര്യങ്ങൾ നിങ്ങൾ വരുന്ന അന്ന് തൊട്ടുള്ള, അതായത് നിങ്ങളുടെ സെലക്ഷൻ നടക്കുമ്പോൾ തൊട്ടുള്ള നിങ്ങളിവിടെ എത്തി സെറ്റിൽ ആവുന്നതിനും വരെയുള്ള ആ ഒരു പ്രോസസ്സ് റേച്ചൽ നിങ്ങൾക്ക് എക്സ്പ്ലെയിൻ ചെയ്തു തരും. അപ്പം അതിനകത്ത് OSCEയെക്കുറിച്ച് പറയുന്നുണ്ട്, റിക്രൂട്ട്മെൻറ്റിനെ കുറിച്ച് പറയുന്നുണ്ട്, പിന്നെ എന്താ പറയുന്നത്, ഇൻ്റർവ്യൂവിൻ്റെ കുറച്ച് ടിപ്സുകൾ കൂടി നിങ്ങൾക്ക് പറഞ്ഞു തരുന്നുണ്ട്. ഓക്കെ, അപ്പം വരാനിരിക്കുന്നവരും അല്ലെങ്കിൽ ഈ ഹോസ്പിറ്റലിലേക്കല്ല വേറെ ഏത് ഹോസ്പിറ്റലായാലും NHSലേക്ക് ഇൻ്റർവ്യൂവിന് കാത്തിരിക്കുന്ന നഴ്സസ് ഈ ടിപ്സ് നിങ്ങൾ തീർച്ചയായിട്ടും കേൾക്കുക, നിങ്ങളത് ഉപയോഗപ്പെടുത്തുക. ഓക്കെ, അത് ഞാനിങ്ങനെ ഒരു വീഡിയോ ചെയ്യാമെന്ന് ചോദിച്ചപ്പോൾ തന്നെ ഷി വാസ് അബ്സല്യൂട്ട്ലി ഹാപ്പി ടു ഡു ഇറ്റ്. അപ്പം ആരെ ഹെൽപ്പ് ചെയ്യാനായിട്ടുള്ള ഭയങ്കര ഒരു എന്താ പറയുന്നത്, ഭയങ്കര വില്ലിങ് ആയിട്ടുള്ള ഒരു ക്യാരക്ടറാണ് റേച്ചലിൻ്റെ. അപ്പം നിങ്ങളിത് കാണുക, നിങ്ങളിത് ഉപയോഗപ്പെടുത്തുക. ഓക്കെ, നിങ്ങൾക്ക് തീർച്ചയായിട്ടും ഉപകാരപ്പെടും. അപ്പം ഇത് നിങ്ങൾ കണ്ടിട്ട് ഞങ്ങളെ അഭിപ്രായം അറിയിക്കണം. പിന്നെ നിങ്ങളിവിടെ വരുമ്പോൾ നിങ്ങൾക്ക് റേച്ചലിനെയും കാണാൻ പറ്റും. റേച്ചൽ നമ്മുടെ ടീമിൻ്റെ ലീഡാണ്. അപ്പം നിങ്ങളെ OSCEക്ക് കൊണ്ടുവന്ന കൂട്ടത്തിലോ അല്ലെങ്കിൽ നിങ്ങളെ വെൽക്കം ചെയ്യാൻ വരുന്ന കൂട്ടത്തിലോ ഒക്കെ റേച്ചലുണ്ടാവും. അപ്പോൾ റേച്ചലിനെ നിങ്ങൾക്ക് കണ്ടിരിക്കാം. ഓക്കെ, അപ്പം നിങ്ങൾ ഈ ഹോസ്പിറ്റലിലേക്കല്ല വരുന്നതെങ്കിൽ പോലും നിങ്ങളിത് കേൾക്കുക, തീർച്ചയായിട്ടും നിങ്ങൾക്കത് ഉപകാരപ്പെടുമെന്നറിയാം. അപ്പം കാണുക. നമുക്ക് അടുത്ത വീഡിയോയിൽ വേറെ വിശേഷങ്ങളായിട്ട് വീണ്ടും കാണാം. ഓക്കെ, ടേക്ക് കെയർ. താങ്ക് യു ഫോർ വാച്ചിങ്. ബൈ.
Hello, I'm Rachel Armstrong and I'm one of the lead nurses for education and quality at the Shrewsbury Telford Hospital NHS Trust. Bindu Rajesh is one of my professional development nurses and she's asked me to record this video for her YouTube channel. In this video I'm going to look at 4 areas. I'm going to give you an overview of our OSCE Preparation programme. I'm going to give you an overview of how many nurses have joined us within our recruitment programmes and who are either waiting to come and join us or who are working within our clinical areas as registered nurses. I'm going to give you an overview of the sort of support and help you can expect from us, either in the OSCE Preparation programme or also out in our clinical areas. And finally, I'm going to give you a few top tips around interview and the sort of things that you need to be researching if you decided to come and interview for us for a job as a registered nurse at Shrewsbury Telford Hospital Trust. So the first thing that I'm going to look at is an overview of our OSCE Preparation programme. So we welcomed our first cohort of international nurses in November 2019. That was a very small cohort of 6 nurses. Since then, we've welcomed a further 16 cohorts of nurses. Cohort 17 arrived at the end of November and have just started an OSCE preparation. At Shrewsbury Telford Hospital, we offer an 8 to 12 week OSCE preparation programme. And within that OSCE preparation programme, we prepare you to demonstrate all 14 skills that you will be tested on within OSCE. That includes APIE, the professional knowledge stations, and then the clinical skills stations that you'll be asked to demonstrate. Also within the OSCE preparation programme, we put you through a mock OSCE. And within that mock OSCE, we try and simulate the experience of what it's like to go through the real OSCE. We test you on all 14 skills that you'll be required to demonstrate within the OSCE environment. And we also give you full feedback once you've completed the mock OSCE so that you know where to focus your skills and your work before you actually go for your actual OSCE. We have 3 cohorts of nurses preparing for OSCE at any one time, so we're a very, very busy project. But we're very, very proud of the fact that we have a 100% pass rate, not always at first attempt, and certainly some nurses from every cohort that we've had so far have had to go back to resit, but they always pass at second attempt. Once you've gone through OSCE, then we put you through a series of skills assessments for cannulation, venipuncture and IV administration, and we also put you through a ward readiness programme, which includes looking at our documentation, doing some work around your communication skills, and also thinking about what it's going to be like to be a registrant in the clinical area. What are the sort of skills that you need? Who are the specialist nurses that you might be likely to meet, etc. The OSCE Preparation programme is delivered by my senior practice educator and 2 professional development nurses, and the ward readiness component is delivered by the 4 professional development nurses that I have working out in the clinical environments, both at Shrewsbury and Telford hospitals. We're very proud of our OSCE Preparation programme. We've had to increase it in the last month because we know that people who are doing the new version of the OSCE, which was introduced from August 2021, have got to demonstrate more skills than the people who are doing the legacy OSCE, which was run before August 2021. So the NMC have increased the skills demonstration by 4 skills stations, and that's why we've had to increase the amount of time that we spend within OSCE preparation. Our OSCE preparation programme runs on a timetable which takes place 9 a.m. to 4 p.m, Monday to Friday, over, as I say, 8 to 12 weeks. Between mock OSCE and you actually taking your real OSCE, we put you out into the clinical area and you do your clinical block so that you can meet your substantive ward teams, you can understand what it's going to be like working there as a registered nurse, and you can start to think about the skills that you will need to develop in order to function within that ward team. So the next area that Bindu's asked me to concentrate on is the project and how many nurses we've actually recruited. So we've run 2 projects in conjunction with Health Education England. The first project, which was our 2019 to 2021 programme, delivered 10 cohorts of nurses and totalled approximately 200. Now, some of those nurses have been with us since November 2019, and some of us joined us relatively recently. But the first project delivered 200 nurses. All those nurses have passed OSCE and they're all out in the clinical areas. And indeed, some of the nurses from cohort 1, from the first programme, are actually Band 6 nurses and charge nurses out in the clinical areas where they started work as substantive international nurses up to 2 years ago. So we're very, very proud of their achievements, and I think what that demonstrates is that even international nurses who join us fairly recently have the opportunity to develop and grow and professionally move on and take advantage of the promotional opportunities that are available within our trust. The second programme, which ran from 2021 to 2022, also recruited 200 international nurses, and as a result of the second programme, we've had approximately 130 to 150 nurses join us already, with the rest expected between December 2021 and February 2022. We had a slight delay in the middle of the project because India closed its borders for approximately 3 months. But we have continued to deliver education and training throughout the pandemic, and as I've said, we have just welcomed cohort 17. So it's a big project, it's a busy project, but we're very, very proud of what we've achieved through that project. So that gives you an idea of how many registered nurses have come through the project and where they're working as a result of that project. The next thing that Bindu wanted me to look at is what help and support you can expect through the different components of our OSCE preparation programme and our ward readiness programme. So within the OSCE preparation programme, I have 3 professional development nurses, 1 clinical practice educator and 2 professional development nurses. My clinical practice educator is Debbie Grafton, and my 2 professional development nurses are Carolyn Hefford and Jamie Henry. Jamie Henry was the first nurse to come through OSCE preparation, pass at first attempt and work out in our clinical area as an international substantive registrant. I'm very, very proud of what Jamie's achieved. She certainly is an inspiration for all the international nurses that have joined us within the project, and she absolutely shows that you can do anything you want to if you put your mind to it. Jamie attended the prestigious Nursing Times Awards in October 2021 and was successful in securing the Rising Star Award. So I'm very, very proud of what she's achieved. So you'll meet Jamie if you come into our project and prepare for OSCE preparation. So Jamie, Debbie and Carolyn deliver all the skills training for the OSCE preparation programme. Once you're through OSCE, then you will be handed over to our professional development nurses, and I have 4 professional development nurses within the project, 2 at Telford, Asha Nair and Bindu Rajesh, and 2 at Shrewsbury, Karen Forrest and Rebecca Owen. And what those professional development nurses do is support you through ward readiness. They ensure that you're assessed for your clinical skills that you might need out in the clinical area. And then they support you in your clinical block between mock OSCE and OSCE, as well as supporting you once you make that transition from OSCE preparation to clinical area. They'll come and support you by doing medicine assessments. They might come and work with you in the ward area if the ward manager feels that you need that extra support. They may provide you with extra study around deprivation of liberties, Mental Capacity Act, adult safeguarding, DATICS, challenging behaviour, and they may also just come along and have a chat, say hello, find out how you're getting on, and support you in those relationships that you start to form with your ward managers, your matrons and the other nurses around you. So they are the resource that's there to make sure that you safely transition from OSCE preparation into the clinical area. The other support that we provide, well, as a trust, we give you 3 months accommodation when you first arrive with us. We give you a bus pass for 3 months, which allows you to get around the county, and it means that you can get to and from your study days for your OSCE preparation every day. And we also always make sure that our training venues are on a bus route, so that becomes much easier for you to get to and from. One of my team will come with you when you go to OSCE. That may be one of the educators, or it may be my admin assistant, Kaylee. So we will make sure that you get to the airport safely if we decide to use Ulster as a test centre, and that's certainly the test centre that we're using at the moment. We'll make sure that you get to your hotel when you arrive in Northern Ireland safely. We'll escort you to the test centre in plenty of time for you doing your OSCE. We'll make sure that you get back from Northern Ireland safely, and you're safely delivered to your home once you've completed OSCE. It's very, very important for me that the only stress that you have at that particular time is the stress of doing the exam. Everything else my team takes care of, so that you always have somebody with you to talk to support you after you've done the exam, and to make sure that nothing goes wrong, either getting to the OSCE or getting home from the OSCE. If we think that we need to escort you to any resits that you might have, I'll always arrange also for one of my team to come with you. And that in a nutshell really is the support that we give you. My team are passionate about international nurses. They're passionate about making sure that you have a really good experience, and they're passionate about making sure that you utilise the skills that you've got in the best way possible in the clinical environment. Finally, I wanted to talk to you about interview techniques. So when you interview for us at Shrewsbury and Telford Hospitals, it will usually be via Skype, because obviously that's the most efficient way of us interviewing you. What I would advise you to research prior to any interview with us is certainly what's included in the OSCE examination, what skills you'll be tested on, because that's the first opportunity that you might have to decide whether this is the right pathway for you, and whether you feel that you are going to succeed at OSCE, and it's what you want to do with your career going forward. I would also ask you to research around the role of a registered nurse. What does a registered nurse do in the United Kingdom? What are the roles that she'll be involved in? What are the skills that she'll need to use, or he will need to use? I would always ask you to research the skills and the attributes that you're going to need in certain situations, because within the United Kingdom we operate in a multidisciplinary environment. So you will work alongside doctors, physiotherapists, occupational therapists, speech and language therapists, amongst others. They will all expect you to be able to challenge them, to be able to have discussions with them, to contribute to their multidisciplinary decisions about patients. You'll also have to work alongside healthcare assistants, and you will be delegating tasks to them, especially if they haven't got the experience and they don't know how to do certain things. You will be guiding them, you will be challenging them over inappropriate behaviour, and you will be setting their day out for them. So it's really important that you understand what a healthcare assistant does and how they can contribute to your daily workload. As nurses in the United Kingdom, we deliver personal care to patients, we support relatives, we have difficult conversations, and all that is within your remit as an international nurse joining us. So I would advise that you fully investigate and research that before you come into any interview for us from Shrewsbury and Telford Hospitals. We'd also ask you a values-based question within your interview, and in that situation we'll give you a scenario, and what we'd ask is that you think about when that scenario happened to you and talk about the experience. So you actually need to talk to us about a time when that scenario has happened to you personally. How you felt, what you did, what decisions you made at the time, and what impact your decisions had on the patient, their relatives, and the other members of staff around you at that particular time. And finally, we might ask you what you think your attributes are, what your values are, what you can bring to our organisation, what we can learn from you and benefit from you as an individual joining our workforce. You should always take the opportunity to ask us questions at the end of the interview. So whilst an interview is about you and us understanding a little bit more about your personality and what you would bring to our organisation, it's also an opportunity for you to ask us questions and make the decision as to whether it's the organisation for you, whether you want to come and work for us. So please make sure that you have some questions ready at the end of the interview to ask us, and that could simply be something as simple as, what professional development can you offer me? You need to be thinking about what challenges you're going to face in the United Kingdom, and that can often fuel your question to us. How are you going to support me as I settle into my role as a registered nurse in the United Kingdom? And we actually like people asking questions, so please take the opportunity to ask your interviewers questions at the end of the interview. Okay, I think that's about me done. I've covered for you an overview of the OSCE Preparation programme. I've covered for you the numbers of international nurses that we've recruited within our organisation. I've told you a little bit about the support that you can expect from us when you join us. And I've also talked to you about some of the areas that you need to research before you come for an interview. I just want to finish by saying that it's my privilege and honour to lead the international project. I love interacting with international nurses, and I believe that they enrich our workforce and bring a real diversity to our organisation. You will be very welcomed, and there will be a lot of you who will feel nervous about coming to the United Kingdom. We want to make the transition as easy as possible for you. I have 3 international nurses in my team who absolutely understand where you're coming from. They understand what it's like to be a long way away from home, and they want to make your transition as easy as possible for you. And that's why I'm so proud to lead this project and have those international nurses in my team, so that I can truly say we understand a little bit of how you're feeling, and we can make sure that we fully support you as you join our trust here in the United Kingdom. All that's left for me to say is I hope you have a lovely Christmas and New Year, and I look forward to meeting you all when you join us here in Shropshire. Take care, and I'll see you all soon. Bye.